Gentlemen, picture this: waking up tomorrow morning with the kind of firmness you haven't experienced in years, naturally, confidently, and without relying on pills, pumps, or risky procedures. Instead, you'll use your own hands and a few minutes of precise and intentional stimulation to reactivate your body's natural erection response. If you've been missing that automatic rise that used to greet you first thing in the morning, stay with me. By the end of this video, you'll know exactly where these points are, how to stimulate them safely, and how often to practice for noticeable results. Why this works, the science behind it before we dive into the where and how. Let's take a moment to understand why this technique works. Once you grasp the science, you'll realize you read not simply pressing on screw, reactivating one of the most powerful and interconnected systems in the male body. Erections aren't random. They're the product of a finely tuned interaction between your brain, spinal cord, nerves, blood vessels, and muscles. Here's how it happens. It begins with nerve signals, teeny electrical messages, traveling from your brain or sensory receptors at lightning speed to the erectile tissue. These signals tell the smooth muscles within the penis to relax, allowing blood to surge into the spongy chambers called the corpora cavernosa. As these chambers fill, the veins that usually drain blood away are compressed, trapping the blood inside and creating firmness. But as we age, this process can slow down. Over the years, blood vessels in the pelvic region lose elasticity due to natural wear and tear, mild inflammation, or conditions like high blood pressure. At the same time, nerve conduction becomes less efficient, meaning signals from your brain don't travel as quickly or as strongly. This combination, sluggish circulation and weaker nerve signals, is one of the main reasons morning erections fade as men get older. Targeted pressure point stimulation helps to reverse this trend. By pressing or massaging certain spots, you activate dense clusters of sensory nerve endings. These nerves feed directly into reflex pathways linked to erectile control. Once triggered, these pathways send powerful signals to the pelvic nerve plexus and spinal cord, instructing the smooth muscles of the penis to relax and the blood vessels to open. Some of these points also influence the pelvic floor muscles, those supportive muscles that stabilize the penis during erection and help maintain firmness. Stimulating these areas helps improve muscle tone and responsiveness, which can lead to stronger, longer-lasting results. In other words, when you press the right points, you're bypassing some of the age-related slowdowns and giving your body a direct hands-on boost. Done regularly, this stimulation can retrain erectile reflexes, enhance nerve sensitivity, and improve vascular flexibility, helping restore the natural firmness you thought was gone for good. Pressure point 1. The base groove. The first point is called the base groove. It sits at the root of your manhood, the exact spot where the shaft meets the pubic area. To locate it, run your fingers along the underside of the shaft, toward your body. You'll feel a slight groove, or indentation, a natural hinge where the erectile tissue connects to the deeper structures anchored in your pelvis. This area feels subtly different from the rest of the shaft, often a bit firmer or more textured, because it's a key meeting place for blood vessels and nerve pathways. Beneath the skin here lies a dense network of sensory nerves, including branches of the dorsal nerve of the penis, along with vital blood vessel junctions that feed directly into the erectile chambers. It's like a control hub where circulation and nerve signals meet. Stimulating this area with small, deliberate, circular motions sends two important signals to your body. 1. It tells your blood vessels to open wider, allowing more blood to flow in. 2. It tells your nerves to transmit arousal signals more efficiently. Here's how to do it correctly. Place your thumb on the base groove, while your fingers cradle the back of the shaft for support. Apply moderate pressure, not so light that you barely feel it, but never enough to cause pain. Make small, slow circles for about 90 seconds. Gradually increase firmness as the tissue softens and warms. You may notice a tingling sensation or subtle fullness in the area as blood flow improves. If you don't feel much at first, don't worry. Sensitivity increases with daily practice. The best times to do this are right after waking, when your body is relaxed, or during a warm shower, as heat improves circulation. Over weeks of consistent work, the base groove responds more quickly, making morning firmness easier to achieve. Pressure point 2. The second point, isn't on the shaft itself, but in a slightly hidden area called the perineum, the soft, springy patch of tissue between the scrotum and the anus. Many men overlook it, but it plays a critical role in erection, strength and control, because it sits directly over the bulbar spongious muscle, a key part of your pelvic floor. This muscle helps trap blood inside the penis during erection, working like a natural clamp to maintain firmness. Over time, especially with age or inactivity, this muscle weakens. By stimulating the perineum, you can reflexively activate and train it, improving its tone and ability to hold blood in place. Here's how to find and stimulate this point. Sit comfortably or lie back with your knees slightly apart. Using your index and middle finger, press gently but firmly into the center of the perineum. Move your fingers in slow, deliberate circles for about 2 to 3 minutes. Maintain steady pressure enough to feel the underlying muscle respond, but never to the point of discomfort. You may notice warmth or a subtle pulsing sensation as circulation improves and the pelvic floor engages. For even better results, pair this massage with light pelvic floor contractions, similar to Kegel exercises before or after stimulation. This combination strengthens the muscles that support and sustain erections, making results more noticeable over time. Pressure. Point 3. The corona ring. The third and final point is located just beneath the head of the penis, at the ring-like ridge where the glans meets the shaft. This area is called the corona, and it is one of the most sensitive regions of the male anatomy, packed with an incredibly dense network of sensory nerve endings. These nerve endings are the body's main messengers for sending arousal signals to the spinal cord and the erection center within it. When stimulated correctly, firmly enough to awaken, but gently enough to avoid overwhelming this area, becomes a powerful trigger for nerve responsiveness, helping your body transition smoothly from arousal to a strong erection. Here's how to do it. Hold your manhood gently between your thumb and forefinger, positioning them on either side of the corona. Apply light, steady pressure and hold for 5 seconds, then release. Repeat this hold and release motion for about 1 minute. Afterward, switch to slow, circular motions around the ridge for another 1 to 2 minutes, gliding your fingers just enough to stimulate the nerve endings, without causing friction or irritation. This method tunes your nervous system, making it more responsive to arousal signals and improving erection quality over time. Done regularly, this technique not only helps restore natural morning erections, but can also enhance overall sensitivity and performance during intimacy. These 3 points work best as part of a short, consistent routine rather than isolated techniques. Here's a simple sequence I recommend to my patients for maximum effect. Bass groove. Begin here for about 90 seconds, using small, steady, circular motions to warm the tissue and boost blood flow. Perineum. Shift to this area for 2 to 3 minutes, pressing and massaging gently to activate the pelvic floor muscles and improve circulation. Corona ring. Finish with this point for another 2 minutes, combining hold and release movements with slow circular strokes to heighten nerve sensitivity. Done back to back, this sequence stimulates circulation, engages the supportive muscles, and fine-tunes nerve pathways, covering all the critical components of strong, reliable erections. Setting realistic expectations. This is not a magic trick that works overnight. Your body needs time to adapt, to retrain blood vessels, nerves, and muscles to work in harmony again. That said, many of my patients begin noticing subtle changes within 2 to 4 weeks, such as improved warmth and fullness in the mornings, erections that last longer, and an overall sense of increased vitality in the pelvic area. For lasting improvements, consistency is key. Think of it like exercise. You wouldn't expect one trip to the gym to transform your body, but regular training yields real results. The same principle applies. Here, this routine strengthens and restores the systems that support natural erections. Lifestyle habits that accelerate results. While these pressure points are highly effective on their own, pairing them with healthy lifestyle choices can dramatically enhance their impact. Stay hydrated. Proper hydration supports healthy blood volume and circulation, making it easier for blood to flow when it's needed most. Exercise regularly. Activities like walking, swimming, or light strength training keep your vascular system flexible and responsive. Strengthen your pelvic floor. Simple Kegel exercises improve muscle tone and work hand in hand with pressure point stimulation to maintain firmness. Eat for circulation. Foods rich in antioxidants, healthy fats, and natural nitrates like leafy greens, berries, and nuts can support vascular health and nerve function. Each of these steps complements your daily routine, helping your body rebuild the strength and coordination it needs for natural, dependable erections. Why morning erections matter. You may be wondering why. Focus on morning erections specifically. Beyond being a sign of healthy function, they provide a natural, daily workout for the erectile tissue. Every time your body achieves this spontaneous firmness, it delivers oxygen-rich blood to the area, keeping the tissues flexible and resilient. When morning erections fade, that daily conditioning fades with them, leading to a gradual decline in performance. Restoring them is like hitting the reset button, encouraging your body to remember how to function at its best. A gentle reminder I always remind my patients: sexual health is a reflection of overall health. By improving circulation, strengthening supportive muscles, and sharpening nerve response, you're not just boosting performance, you're also supporting your cardiovascular system, your nervous system, and your confidence as a whole. This approach is safe, drug-free, and completely within your control. No prescriptions, no risky procedures, just simple, precise, hands-on care that reconnects you with your body's Natu gentleman. You don't have to accept weaker or disappearing morning erections as an inevitable part of aging. With just a few minutes each day, you can retrain your body, restore confidence, and feel that sense of youthful vitality again. Practice these 3-point techniques daily. Be patient with your progress, and support your results with healthy habits. Within weeks, you may notice that familiar fullness returning in the mornings, a sign that your body is remembering how to respond the way it used to. I'm Dr. Mark Turner, and I encourage you to take action today. Start this routine, stay consistent, and experience how much better your mornings and your overall health can feel.